From your vantage point again, what is it that India could learn possibly from other countries that are going through similar waves as part of the nature of this virus, as you called it? What could we learn from the United States at this particular moment, whether in terms of vaccination drives, whether in terms of other policy measures that need to be taken?
Yeah, I think India can learn from the US, but can certainly learn from Europe, what many European countries are doing in face of a major wave that Europe has been facing. Look, there are 3 or 4 things that keep this virus under control. One is certainly universal mask wearing, that Indian policymakers should be wearing masks. They should be promoting mask wearing across the country. People should not be gathered in large groups without wearing masks. And people should really avoid indoor gatherings as much as possible. That's number one, mask wearing. Second is crowds and having fewer large events. Again, I've been seeing pictures coming out of India of these massive gatherings. Very, very concerning. Now, again, safer if it's outside, very dangerous if it's inside, but really pulling back. Third is I think we need to do more testing. India has done a pretty good job on testing, but one of the advantages of large-scale testing is you find more infections and you can stop them from spreading. And then certainly last but not least is continuing to push on more vaccinations. India has a lot of vaccines. It's been doing a good job on vaccinations. It has to drive those vaccination drives numbers even higher for a population its size. All of this is a way to prevent lockdowns. If nothing else works, then you're looking at very aggressive, tight lockdowns. But that's a very costly measure. And my hope is that India can avoid that across the country. I know in some places we're starting to see lockdowns, but I think that should really be the policy of last resort when everything else has failed.
So in your view, therefore, as you said, lockdowns only as a last resort. Is there a critical stage at which a country must decide when to go in for a lockdown? Some countries have been very effective with their lockdowns. Others have, as you rightly said, have found them extremely costly. So are you saying that this is too early, premature for India to go in to even consider the potential of the possibility of a nationwide lockdown? Are you saying have tight, localized lockdowns?
Yeah, I don't know that a nationwide lockdown would make sense given how regional the infections are and how the outbreaks are. So I would certainly try to limit it to local areas as much as possible. I think that's one. Second is that, lockdowns, as I said, are the last resort. So when should you trigger them? When you start seeing the healthcare system truly get overwhelmed. I'm seeing stories out of Mumbai, Nagpur, elsewhere, where hospitals are running out of beds. That in some ways is kind of on the late side. You want to see, once you start seeing a surge of hospitalizations, you are in trouble. And that's when you got to get much more aggressive, maybe including lockdowns. But the hope is to never get there. And when I look at the India data, case numbers have been rising for 2 months. By late February, it was very clear that another wave was coming. And, here we are mid-April. But policy response is just too slow. Like, if you wait until you have this many infections, things are going to get much, much worse. So acting early is the key here. Right now, I think localized lockdowns make some sense where hospital systems are really struggling. But other than that, I would try to avoid anything national.